Good evening. Now, the COVID-19 pandemic is a disaster that has severely disrupted the normal functioning of populations around the world and continues to proliferate indiscriminately. While the pandemic threatens the health of all, other hidden consequences exist. Consequences like increased sexual and gender-based violence. Various measures have been taken globally to prevent the spread of COVID-19. And some of these measures, such as lockdown and social distancing, however, mean that people who are most vulnerable to abuse and violence are locked at home with abusive spouses, partners, and family members with limited access to support services, if any. On this KTN News special tonight, we take a look at prevention and response to gender-based violence during the COVID-19 pandemic. My name is Sharon Momanyi. Welcome to the program. Now, we'd like to invite you to be part of this conversation, and you can send your questions on Twitter using the hashtag #StopGenderViolence. We're also available on Twitter at KTN News KE, and you can tweet me directly at Sharon_Momanyi using the hashtag #StopGenderViolence. It is with this hashtag that I will be able to trace your questions and your contribution to this conversation, very important conversation tonight, so that we have a very engaging one at that. Allow me now to introduce our panelists tonight, panelists who are widely involved in gender affairs and are involved in it day to day and will be contributing to this topic tonight. First, we have Professor Margaret Kobia, who is the Cabinet Secretary, Ministry of Public Service, Youth and Gender Affairs. Prior to her cabinet position, Professor Kobia served as the chairperson of the Public Service Commission. She has also served as the vice chair, Judicial Service Commission, and is a member of the United Nations Committee of Experts in Public Administration, SEPA, that advises the UN Economic and Social Council. Prior to joining the Public Service Commission, she was the founding Director General of the Kenya School of Government. She has also served as the Director and CEO of the Kenya Institute of Administration. Professor Kobia is an Associate Professor of Management and Entrepreneurship and has taught management, entrepreneurship, and research methods at university level. Our second panelist tonight is Dr. Annette Mbogo, who is an advocate of the High Court of Kenya with experience in civil society. She has worked at the Children's Foundation, The Cradle, Christian Legal Education, and Aid and Research. We are pleased to have you, Dr. Mbogo, on the panel tonight. We also have on the panel Jean Kemitari, who is the Programs Director at Urgent Action Fund, responsible for strategic leadership and program implementation. Previously, she worked as Program Manager for the GBV Prevention Network at Raising Voices. Prior to that, she was engaged in chronic poverty research and policy advocacy, where her advocacy efforts contributed to the development of a social protection policy in Uganda. We also have Wanjiru Kamanda, the Deputy Director of FIDA, and Wanjiru Kamanda is an advocate of the High Court of Kenya with more than 9 years of experience in managing human rights, gender, governance, and election dispute resolution programs. All right, and let's just get straight into it, getting into this conversation of gender-based violence and its increase. There are statistics that show that there has been an upsurge in gender-based violence and physical abuse world over during this COVID-19 pandemic. And I want to start with you, Wanjiru, just to paint a picture. When we speak about increased GBV in times of crisis, what exactly is the correlation between crisis and increased sexual and gender-based violence? Sorry, I will start with you, Professor Margaret Kobia, the CS Gender, just to paint a picture of that correlation. Why are we seeing this upsurge? It's not just here in Kenya. Just for our understanding, what are the triggers of this increase in sexual and GBV here in Kenya and the world over?
Thank you. Thank you very much, Sharon, for having me to speak on gender-based violence, and in particular, this season of COVID-19. Gender-based violence, Sharon, has been a concern to government all over, and particularly in Kenya, that's why you find government as already a ministry and a department that is concerned with general issues of gender. We more work around gender equality, and this gender does not necessarily mean women. It means both, it includes both women and men. It's just how various roles are assigned just because you are male or female. Therefore, we find gender-based violence against the backdrop of COVID-19 being more prevalent in the sense that right from March, when COVID was announced globally, the number of gender-based cases increased globally by 30%. And that's why the Secretary General of the United Nations brought to the attention of all member states, who are over 193, that they need to be on the watch out what is happening as far as COVID was having a big impact on gender-based violence. And not only just gender-based violence, even domestic violence in particular. The reason why during this season we have found an increase of about 30% of gender-based violence or domestic violence is more concerned with the situation people find themselves in. When there are many cases of gender-based violence reported, the government would be very concerned because, as you know, government exists to take or to ensure that the citizens have got a better quality of life, where everyone, both man or woman, they have an equal opportunity socially, politically, economically, and culturally, that everybody requires to be given an equal opportunity. Therefore, when there is a bit of gender-based violence, we are already seeing a pattern where most of those who are reporting gender-based violence or domestic violence, 90% are women. And then about 10% are men. Therefore, that bothers government, and we have found that the number of this domestic violence has increased as actually an intended outcome. One thing, the fact that people are home for longer times because of the curfew, you find different homes or different communities have got different number of increase in gender-based violence, and there are several factors. We might not just say one, but you find where in the families there was already a conflict caused by certain disagreements. They are likely to have those gender-based violence. Families where one, maybe spouse or partner, is experiencing some stress levels just because maybe a lot of people have lost their jobs, and it happens 60% of those who have lost jobs are women, especially those who are on jobs which are on daily wage earning. Therefore, you find those stress levels make people irritable, and they are likely not to have a good relationship, and anybody answering the other in a way that the other one feels offended, then it results to either assault or emotional abuse. So I think when we are talking about domestic violence, it's not just physical assault only, even emotional, where people, maybe the way they talk to each other, the way maybe they are denied something like food, it could be a cause of that. So we find now with the curfews, where people maybe are having to be home for longer, or others even coming home late. It becomes a source of concern, and then you are seeing these cases. In the month of March, through our hotline, the government hotline 1195, we had like 52 cases of gender-based violence. By the month we reached April, we had about 85. By the time we reached May, it is 115. So what that number is telling you is, if we do not give some responses or some comprehensive services to those who are experienced gender-based violence or domestic violence, then it makes it very difficult for the communities to exist in a harmonious manner or even enjoy a better quality of life. Sharon?
Now that we are talking about an increase, and you have actually given us the numbers of how these cases, as reported through the government hotline, have been increasing month by month, can we possibly talk about prevention at this stage, seeing as we are seeing that it is in households that there were already cases of domestic violence and abuse in whatever form, that we see this being exacerbated during the pandemic? Are there possible ways of preventing the increase, or in cases where it has not yet happened, preventing these cases of gender-based and sexual violence?
One way of preventing, there could be several ways, not just one maybe size that fits all. Being aware that people are stressed, that could be an indicator that there is likely to be domestic violence. Therefore, when families or people working in the same place tend to be a little bit stressed, and the way you tell somebody is stressed, it may be the way maybe their behavior. For example, if they seem to withdraw, they seem irritable, then you can more or less think these are somebody who is irritable. The other way of preventing is, of course, you have seen government come and provide some social safety nets where, because some of the causes are as a result of no resources or no finances, therefore government also is making sure that those who are most vulnerable are given some funding to be able to afford basic needs. You'll find domestic violence actually is more prevalent where the people are kind of poor. And for that reason, providing a bit of that support in terms of, I think now we are doing it more in cash transfer, because cash transfer is more dignified. The family members they can be able to buy food in the shops. They can be able to buy other whatever they need, sanitary towel, rather than give food itself. We are not saying giving food is not appropriate, but you'll find if you really want to dignify people, give them their resources or funds in the form of cash transfer through their mobile phones, and they will be able to go to a shop or a kiosk and buy what they need. It might not be a lot. We have been giving like 2,000 per household per week, which I think it goes a long way to support. Also, the vulnerable, those who are living with the disabilities, they have also been getting through Ministry of Labor and Social Services and some cash transfer. So making sure that people have resources, or making sure they have jobs, or making sure that the communities, they kind of take a responsibility, because when domestic violence happens, people are here, you get to hear, but I think in our situation and in our context, a lot of people keep quiet. They say this is a domestic matter, we will kind of not bother or kind of report to anybody. Therefore, what the government has done is to make sure that, and the government does not work alone, we work with the community services, civil societies who work around that area, and the other government departments, so that we have partnership to be able to give that awareness that let us not accept domestic violence. When you hear of it, it is important that we raise our voice, so that within the community, within the neighborhood, within the churches, then we find what is the real cause of this domestic violence. When we find the real cause, then the intervention will be able to help those who have been affected, and that's why government has got interventions like trying to have the hotline, trying to have safe houses for those who are able to move to some safe houses. There are some privately owned, and a few in some counties you will find some safe houses. Of course, we are not saying as we prevent them, there is also the legal redress that those people who experience domestic violence is a crime, and of course, when one is punished, then it serves as a deterrent punishment to those who might do it. So, and also through psychosocial counseling, people get awareness that there are other ways of controlling or being self-control or controlling hunger rather than assaulting one another. Right. Therefore, being a criminal offense, I think that punishment is also a kind of a deterrent. Another way of preventing, of course, when it has happened and there's people can be able to report at the police station. But what we are finding now with the COVID and the police being out there with very many assignments, therefore we can see maybe that service might not be as efficient as expected, and we understand why. That's why during the COVID season, even we should try to tolerate one another, because if you are to report through the police, who we work very closely with, every police station has a gender desk where they deal with issues of gender-based violence, defilement, and another sexual assault. Therefore, those also are made available as services that the people can be able to be supported as a way of making sure that domestic violence does not become a way of life. Let me also, Sharon, point out that most of the people who seem to practice practice domestic violence seem to have experienced in their homes. Okay.
I'll come back to you, Prof. Let me engage Dr. Annette Mbogo. Now that we are talking, you've brought up the issue of legal redress as one of the ways of preventing, the upsurge, the increase of these cases of violence. And Dr. Mbogo, just speaking about legal redress, I don't know how much awareness and access that people who are prone to this kind of abuse have, particularly at this time. Do you see this as a challenge? Do the victims know who to talk to, where to go when they are, in cases where they are prone to abuse?
Thank you very much, Sharon, for allowing us to be part of this conversation. So I work at Kituo cha Sheria, which is a legal empowerment organization. And one of the things that we try to do is to empower communities, especially those who are vulnerable and marginalized, to be able to use the law as a tool to protect their rights. I think when we talk about access to justice and also in instances of sex and gender-based violence, I think in an ordinary setup, we already find a lot of barriers for victims of SGBV to access justice. And in situations like this where we have an impending pandemic, the situation is even exacerbated in a much worse position. And so because we have structural barriers that stop people from accessing justice. So in terms of legal redress, we have a very broad legal framework that allows for victims of SGBV to be able to receive legal redress. The Constitution in itself is one of the ways in which they can receive legal redress, because protects the right to non-discrimination, freedom, and right to freedom and personal security, so the inherent dignity of the person. and finally also guarantees access to justice. We also have specific legislation that address the issues around the SGBV. So for example, we have the Sexual Offences Act that deals with sexual-related violations. We also have the Protection Against Domestic Violence Act, which now specifically provides for means of protection for people who have faced this kind of violation. And so they approach the court for protection orders under this act, and the court can issue orders, and through these orders then they can be separated from the perpetrator of that kind of violence. And finally, we have now other alternative forms of justice. For example, Kituo works very closely with paralegals. So paralegals have been very crucial in ensuring that where communities are not able to access the courts, then they...
All right, let me, as we try to fix that network issue, let me bring in Jean Kamitare, who is from Action Fund Africa and is joining us from Kampala, Uganda. Many thanks for joining us this evening. And we are talking about prevention and maybe some of the challenges that the victims or people who are prone to SGBV face in trying to, just being able to protect themselves. Maybe you can talk to us about the situation in Uganda and what kind of activities as an organization you are involved in trying to, bring up the structures of protecting the vulnerable.
Thank you very much, Sharon, for this conversation, especially crucial at this time when COVID response is focused on the health aspects, biomedical responses, militarized responses, and ignoring the impacts on women and other marginalized groups like gender-based violence. I work for Urgent Action Fund Africa, which is a Pan-African feminist fund that provides technical and financial support to women's rights organizations across Africa to address time-sensitive and strategic opportunities to advance women's human rights. And of course, right now, we are in such a time when there are a lot of time-sensitive and strategic needs, including gender-based violence. So to speak about Uganda, in general, violence against women or gender-based violence is high. For example, 1 out of 3 women or 30% of women globally in ordinary circumstances experiences violence. And when you have an emergency, including a pandemic like COVID, that experience of violence gets worse. So it's true for conflicts, it's true for other epidemics like Ebola, that gender-based violence cases will go high. They've asked about Uganda. Within a month of the lockdown, there were 5 murder cases recorded, but that might seem like a small number. Today, the Ministry of Gender has set up COVID response subcommittee to address gender-based violence because they've recorded 5,568 cases within the 2 months of lockdown. And that is what is being reported. Remember that the most of the gender-based violence that occurs is never reported. This is because it's rooted in stigma and shame. And so it is hard to report this.
Right.
In terms of what we are doing as a fund, we've had like 3 times an increase of 3 times grant requests, and over 50% of those are requesting for support to respond and prevent gender-based violence across Africa. So we are providing financial resources for immediate response, which includes access to legal aid, as Prof. and the colleague from Kituo spoke about. It includes access to healthcare, medical care. It includes access to psychosocial care, telephone counseling, and in some cases, access to safe houses where it is completely unsafe for women to stay in their houses. So that's one part of what we are supporting, the response, but also in terms of prevention, we are supporting awareness-raising activities because violence is rooted in social norms that accept, men to have more worth and value over women. And that comes with a whole range of power dynamics. And with the stress of pandemics and other emergencies, those power dynamics become worse and end up in violence, as was said earlier.
Right.
Yeah.
And Wanjiru Kamanda is the Deputy Director of FIDA. And what Jean has highlighted here, and which forms a huge part of these conversations when we are talking about the most vulnerable to SGBV, is that many of these cases are actually underreported. And while women and girls are the most vulnerable, Prof has talked about in Kenya 90% of those who are victims are actually women, but we can't not talk about the 10% who are men. And most of the time we see that they don't report these cases, and when they are in situations of abuse and violence. And where do they come in this conversation, and particularly in raising and equipping them to be able to seek help when in these vulnerable situations?
Thank you, Sharon. You've very true what you've pointed out, that gender-based violence cuts across the divide. There are women affected, men affected, boys affected, and also girls affected. The reason why there's more focus on women and girls is because, as Prof had mentioned, the statistics is that majority of victims are female. That, however, does not take away from that. For them, what we've seen even with the police and the prosecutors and our courts is that the cases of violence against men and boys are also taken as seriously as the cases of violence against girls and women. All we do is call upon men to also come out and report. And we've seen men reporting. I'll give an example. FIDA Kenya launched a toll-free number on gender-based violence on 15th of April this year. And as much as the majority of cases that we've received on sexual gender-based violence are from women, where women or girls are victims, we've also received a few cases where the victims are male. I'll give an example. We've received a total of 158 sexual and gender-based violence cases. And out of these 158 sexual and gender-based violence cases, 20 of them are defilement cases. And one of the defilement cases that we've taken up and are following up is a sodomy case against a small boy who was violated by their milkman. We've also received a total of 104 intimate partner violence cases. For this, all of them are actually female. The victims on this are female. So while we will focus on women and girls, we also realize there's a percentage, however small, it's not negligible, that men also suffer. And we call upon men to also report. There's the government toll-free number 1195. There's the FIDA number 0800 720 01. We do not discriminate. We take up cases, and where we cannot act, we refer. For example, for the victims that we've received where the issues relate to men as victims, we refer to our assistant brother institutions such as the Law Society of Kenya and Kituo cha Sheria. So just calling upon the men to also report. And the stigma that Jean mentioned also affects men, that they'd be so scared because society in a way has normalized violence against women, but we see that as a taboo to discuss or even raise the issue of violence against men. So it's just calling upon the men to report, not to fear to report even to the police.
Right. And I think what we need to talk about now, and the bulk of our conversation when we come back, because we want to take a short break now, is to talk about what can we do for that person, that woman, that girl, that man who is in a vulnerable situation, in an abusive relationship and locked down with an abusive partner. What are the steps to take to prevent, or in the case of where you have been sexually or physically abused, what are the steps to take, who to talk to? And we want to dwell on that very important part of this conversation when we come back from this break.